Welcome, everyone. Thank you for joining us in Investing in Health, NCD Prevention and COVID-19 Recovery, co-hosted by Vital Strategies and NCD Alliance. Spanish language simultaneous interpretation is available during this session. The feature has already been activated and is available by clicking the interpretation button at the bottom of your screen, where you can select the language that you would like to hear. For those of you just joining us, you are at the session titled Investing in Health, NCD Prevention and COVID-19 Recovery, co-hosted by Vital Strategies and the NCD Alliance. My name is Hermes and I will be your technical facilitator today. So if you have any issues, you can please contact us to help you with your Zoom. Before we get started, I have a few technical notes to explain. If you would like to contribute a perspective or ask questions, please use the Q&A box, which you can find at the bottom of your Zoom window. Please note that this session will be recorded for documentation purposes, and we are also streaming live on Facebook to enable a larger audience to take part in the discussion. I will now pass the floor to Ms. Amanda Glassman, Executive Vice President and Senior Fellow at the Center for Global Development. Amanda, the floor is yours.
Thank you, Hermes. Good morning, afternoon, and evening to everyone on the line. I'm Amanda Glassman, Executive Vice President and a Senior Fellow at the Center for Global Development and your host for today's Vital Talks event. On the sidelines of the 74th World Health Assembly and on behalf of Vital Strategies and the NCD Alliance, I am proud to welcome you to Investing in Health, Non-Communicable Disease Prevention, and the Recovery from COVID-19. We have an exciting agenda ahead of us. We'll start off with welcome remarks from José Luis Castro, who's the President and CEO of Vital Strategies. Unfortunately, Princess Dina, who's the Special Envoy for NCDs at Vital Strategies, is not able to join us at this time due to a power outage in Jordan. We'll stay tuned on that. But we're really lucky to be joined by an excellent panel with some really leading voices in NCD prevention and global health. So let's get started. I'll turn it over to our first speaker, José Luis Castro. Thank you.
Good morning, good afternoon, and evening to you all. Buenos días a todos y todas. On behalf of Vital Strategies, it's my pleasure to welcome you to this 12th installment of our Vital Talks series on the sidelines of the World Health Assembly. In January 2020, when COVID-19 did not yet have a name, but was spreading rapidly, Vital Strategies could see that a pandemic was imminent. With our strong partnerships around the world, and after years of advocating on the global and national levels for better health systems, we knew our work will be critical in addressing the growing crisis. Over the past year and a half, we rapidly expanded to support over 50 countries in their COVID-19 response efforts. We were nimble, taking in new challenges, but we also never lost sight of our central work to prevent and reduce non-communicable diseases, such as cancer, heart disease, and diabetes. Worldwide, 7 out of 10 deaths are due to NCDs. We have seen that COVID-19 is particularly cruel to people living with NCDs, as they are more likely to be hospitalized and are at higher risk of dying. But the millions dead and the economies damaged by COVID-19 weren't inevitable. They were caused by dangerous gaps and lack of investments in our health systems. Today, distinguished speakers will shed light on the ways that governments can tilt economies away from ill health. They will share innovative and forward-thinking solutions that countries can adopt to divert subsidies away from industries that harm our health and instead generate revenue for social good that can be used to build stronger public health infrastructure for all. We need bolder, better, and more equitable approaches to health. And I'd like to thank our speakers for their leadership on this critical and timely topic. I would also like to extend our warm thank you to our partner, the NCD Alliance, and to our moderator, Amanda Glassman, and our audience for joining us today. So I'm now honored to welcome you to this Vital Talks, and I'll turn it over to Amanda.
Thanks, Jose. So as we move towards the moderated discussion, I'd like to start with a couple of Zoom housekeeping tips. I'm sure we're all experts at this point. At the bottom of your screen, you'll find a question and answer box. Please use that feature to pose any questions to the panelists. And you can also send your questions in anytime during the talk or send a tweet using the hashtag #VitalTalks or hashtag #ActOnNCDs. So in just a few moments, we'll be joined by our speakers on the panel. We have public health leaders, each with incredible backgrounds in NCD prevention and a passion for policy. If you'd like to read their full bios, please visit the link that has been posted in the chat. We hope that everyone that has joined this session leaves with an understanding of the urgent need to invest and prioritize non-communicable diseases within health prevention and care, and the tools that we will need to implement proven policies. I'll just take a moment to talk about our work at the Center for Global Development. We're an independent, nonpartisan think tank. And we have been looking at the fiscal policy tools to fight non-communicable diseases. And they are particularly relevant as we think about this time where non-communicable diseases are such an enormous risk factor for COVID-19 hospitalization and death. So even before the pandemic started, we know that health taxes were a very powerful tool to reduce the consumption of tobacco, alcohol, and sugary sweetened beverages. These are also known as product-specific excise taxes by fiscal wonks. And they were a good tool, therefore, for improving health and for raising revenues as well. And such revenues are really urgently needed right now. The drops in revenues to governments as the result of the COVID-19 recession and economic crisis are enormous. Particularly in Latin America, I know a lot of people are joining us from the Latin American region. The drop in growth in those countries has been in the order of 7 to 8%. That is uniquely high around the world. And so this is a great opportunity really to think creatively about what are new sources of revenue to be able to bring fiscal support to close the gap of 12 trillion and rising in revenues that we see around the world. So we have done a recent paper where we look at how beneficial health taxes could be for many low and middle income countries. We estimate that they could raise from about 0.6 to 0.7% of GDP if we were to tax tobacco, alcohol, and sugary sweetened beverages at a higher rate. And that is a revenue gain that is similar in size in some countries to that could be gained through, for example, taxing fossil fuels. And we argue that we should be thinking about these issues of taxation in exactly the same way. These are health taxes. Fossil fuels are also bad for health. And tobacco, alcohol, and sugary sweetened beverages should be treated with the same level of priority because they have the same revenue potential as well as the same health potential, plus the very positive effects on climate as well in the case of fossil fuels. So that not only do they have a clear health benefit, they can save lives, reduce also the economic and social costs of the consumption of these products, and they can raise revenues. And we have also estimated that this amount that we could potentially gain by raising these health taxes would actually help to cover the costs that have been incurred through the COVID-19 response. We think this is a win-win, both in terms of an immediate fiscal response to COVID-19, as well as a way to reduce the risk factors that are making COVID-19 such a disastrous experience for all of us, but particularly in countries in Latin America and around the world, really. And in India, we're seeing it every day. So with that motivation in mind, I'll now turn to our panel. We're giving each speaker 3 minutes to answer the first question. We'll do a couple of rounds, and we're going to start with Lynn Moeng Malangu, who's the Director of Health Promotion and Nutrition at the Department of Health in South Africa. Lynn, in South Africa in 2019, you introduced a health promotion levy on sugar-sweetened beverages. And you've also studied it very carefully. So from your vantage point as the Director of Health Promotion and Nutrition, can you tell us more about how this tax came about how it has reduced the intake of sugary sweetened beverages and how it has worked for revenue as well. Thank you.
Okay, thank you very much. I will go straight to the responses because of time. As some of you may be aware that obesity rates there's been a rise in South Africa over the past few years. The various surveys have demonstrated an increase, especially amongst women. So as a result of that, the country took a decision in 2015 to come up and develop a multi-sectoral strategy for the prevention and control of obesity. And one of the key goals of the strategy was to create an enabling environment that supports availability and accessibility to healthy food options in various settings. And to achieve this goal, one of the key activities that were identified as being cost effective at a population-based intervention was fiscal measures. So, and when research was presented to us, we then identified liquid sugar as the main culprit. And other studies also indicated that children are actually consuming much more beverages, sugar-sweetened beverages, and then this became an important activity. So sugar-sweetened beverages became an obvious choice. And the taxation of the sugar tax has actually shown us desired outcomes. We have seen a reduction in consumption. Sugar tax has been, that has been documented. There's actually a study which indicated that there's been 29% reduction in the volume consumed of sugar sweetened beverages, and also a 51% reduction in sugar from these beverages. So for us, this is an indication that there are benefits in taxing sugar. And actually the decline is seen more in low income groups who obviously are guided by the price of products. So this is actually an indication that an increase in price does have an impact in the decisions that people make. Unfortunately, there's been a slight decline. The decline in terms of intake started already when we were advocating for the sugar tax, when there was public education, advocacy work. People started gradually buying less of the sweetened beverages, but we then saw a higher decline, a bigger decline when the sugar tax levy was actually implemented. So that for us was a very important step. And I think one of the issues that you wanted to find out from us, whether there has been any benefits in terms of revenue. In the first year of implementation of the sugar tax, which is 2018-2019, our treasury actually received more than 3 billion just from the sugar tax. But over the years, this amount is gradually declining. Partly, it could be because of the reformulation of products by industry. Though it's a benefit for us, the reformulation, it's actually affecting the revenue, but obviously the main purpose of this was not only the revenue, it was to see the decline. So we really appreciate and we do see the benefits thereof. Thank you.
Thanks, Lynn. Can I just follow up with a quick question? Someone is asking,
Yes,
how
please.
much is the tax in percentage terms of the product cost? Do you have that figure at hand?
Yes, it's 2.1 cents per teaspoon, which is, I could give out the calculation later, but that's how much it is. But what they have done in terms of determining the first 4% of the sugar in hand, it's not taxed. And this was based on the fact that milk has a baseline of so much, and not to complicate how the calculation is conducted. Treasury could not separate milk as a beverage from other beverages. So all have an allowance of about 4%, and then anything above that then get taxed. All beverages do get taxed. Yeah.
Thank you.
Thank you.
Okay, let's turn to our next panelist, Alison Douglas, who's the Chief Executive of Alcohol Focus Scotland. Thanks for joining the discussion today. You bring insight both in your current role as CEO of the non-governmental organization Alcohol Focus Scotland, as well as former head of alcohol policy and delivery at the Scottish government. Scotland is really a leader in this area, one of the few nations in the world to have introduced a minimum unit price for alcohol. Can you tell us a little bit about that concept of a minimum unit price and why Scotland has opted for this measure? And also to refer to a question that's in the chat, what was the industry response and what has happened during the pandemic with industry response? Over to you.
Thanks, Amanda. Yeah, so a minimum unit price is a really simple mechanism. It basically sets a floor price for a unit of alcohol, which in the UK is 8 grams of alcohol, and no alcohol can be sold below that floor price. So if we take an example of a can of beer, if that has 2 units of alcohol in it, it can't be sold below £1. Prior to minimum unit price, a unit of alcohol could be sold well, at any price, but the cheapest that we found was 18 pence per unit. And what we'd seen in Scotland was the alcohol had just got cheaper and cheaper, and over 30 years before minimum unit price came in, it had become 75% cheaper. So it was literally cheaper to buy a bottle of beer or a cider usually than bottled water. And that was just unacceptable, because what we were seeing as a consequence was massively increased rates of consumption and a doubling in alcohol-related deaths. Obviously, internationally, tax is the most common mechanism that's used to control alcohol price, although usually the predominant rationale for tax is raising revenue rather than a public health rationale. But here in Scotland, we didn't have the option of alcohol taxation because we don't have those powers. So in part, it was necessity that we looked at minimum unit price. But in practice, what we found when we looked at it was that minimum price is a much more targeted measure than taxation. And that's because it focuses really on the cheapest, strongest alcohol, which is the alcohol that people, the heavier drinkers, people who experience the greatest harm, that's the alcohol that they're drinking or that they end up drinking as their alcohol problem develops. Interestingly, moderate drinkers are not affected at all by minimum unit price because they're really not drinking enough alcohol and enough cheap alcohol to feel the difference. And nor is the price affecting pubs or restaurants because they were already selling way above the minimum unit price. You asked, person asked in the chat about the industry response. You know, interestingly, public support for minimum unit price has always been fairly strong, but has grown since the policy was implemented. And there was a very broad political consensus in favour of minimum unit price because of the evidence base being so robust. But the industry, particularly alcohol producers, were very resistant to this policy. And many of you may be aware that they went to as far as they possibly could in trying to prevent minimum unit pricing being implemented in Scotland. And they took the Scottish Government to court. And so the policy was delayed by 6 years. And ultimately, the Supreme Court in the UK decided that minimum unit price was indeed legal, and that the case had been made that it would, or that the Parliament was well within its rights to implement this policy because they believed it would save lives. So the delay of implementing minimum unit price has also had an effect on our expectations of the impact of it. we're already seeing positive impacts, and I think we might come back to that later in discussion. But what we are concerned about is that the delay has eroded the impact of minimum unit price due to inflation. And for anybody who's looking at this policy and possibly about implementing it in your country, what I would say is that the policy really needs to be index linked so that it keeps pace with inflation, but it also needs to be recalibrated so that once you see the benefits that are accruing and that there are not, as there are in Scotland, no particular negative consequences from the policy, that it can be recalibrated so that we get more of the benefit, we save more lives, and we reduce harm.
Thank you, and a very practical and important point about keeping these policies effective over time by making sure it's calibrated to inflation. Now let's turn to Dr. Nandita Murukutla, who's the Vice President of Global Policy and Research at Vital Strategies. You've been leading some work exploring subsidies for unhealthy commodities like alcohol and fossil fuels. And that's another reason to look at the levels of taxation and the way that these are treated fiscally. Can you tell us a little bit more about these kinds of subsidies on unhealthy commodities that we're seeing?
Thank you, Amanda. Vital Strategies recently released a report called The Sobering Truth. And in this, we describe how governments often inadvertently incentivize alcohol, death, and disability. This report is in continuation of a series of reports in which we've looked at incentives to unhealthy commodities, including fossil fuels. And the central argument of our report is that these economic incentives are perverse. We specifically use this economist term of perverse incentives because these incentives go against the fundamental interests of the payers. They harm health and they affect societies and present a burden to them. So let me unpack that further. Harmful use of alcohol is well established as a major public health and societal issue. It's responsible for more than 3 million deaths annually, and we know that it costs societies. In the US alone, it's responsible for nearly $250 billion a year in social and other health costs. We also know that fiscal policies are important to reduce access and availability to unhealthy commodities. And therefore, WHO's safer technical package for reduction of the harmful use of alcohol, for instance, calls on pricing policies to both reduce access to these unhealthy commodities, but also to serve as a means of revenue. And yet, despite all these global pronouncements and commitments, despite all the evidence that we have to bear, what we find in our report is a continuation of perverse incentives to unhealthy commodities, and that is essentially the thrust of our report. In our report, we find evidence of a range of incentives. These range from development assistance, tax breaks, tax rebates, to marketing deductions. And what we also find is that the ultimate beneficiaries of these incentives are a handful of multi-billion-dollar transnational corporations. And so in sum, our point is there is an inconsistency, and this is a wasted opportunity. On the one hand, we have public commitments and flailing public health efforts. And on the other hand, we have the incentivization of those very industries that cause harm. What was egregious before is essentially unconscionable now in the context of the pandemic and the post-pandemic recovery. And therefore, we propose that governments phase out incentives to unhealthy commodities, reinvest in social protections and programs, and essentially use fiscal policies to prevent NCDs. Thank you.
Thank you, Nandita. And I would say also in our work, there's another form of subsidy in the sense that the government has to pay for the costs of this consumption. That's also a subsidy that we are giving to the consumption of these products and to those companies indirectly. So completely share your thinking on this. Now let's go to Pierre Cook Jr. He's the Youth Voices Technical Advisor at the Healthy Caribbean Coalition. Pierre, you're actually the Prime Minister of the Barbados National Youth Parliament. You're also a first-year law student at the University of the West Indies and an advocate advising the Healthy Caribbean Coalition. Can you tell us about what you're seeing in your community, why NCD prevention policies are important to you and other advocates? Help ground us in reality.
Thank you very much for inviting me to just present for you guys this morning. And it's always important to have a young person as part of the conversation, because I do believe that we bring a critical perspective that is sometimes overlooked. And I want to underscore right now that there is a need for government, the private sector, and society in general to invest in their young people and their future. And this doesn't only speak to educational investments, which we see our government's doing, but it extends to ensuring that we have access to the highest attainable standard of health. And this is as a human right. I mean, specifically in Article 5 of the Universal Declaration of Human Rights, it speaks to the right of every person as a part of their fundamental right to a life of dignity, of the right to health. And I mean, we could have a larger discussion about why governments are necessarily bound to these international commitments, but that will take us down a legal rabbit hole that I would love to, but it's not quite appropriate for this discussion. And we must understand that as countries who've dedicated themselves to the recognition and protection of the rights of all people, this engages that this right to health and human dignity must be protected of all people. Now, today, we don't see in a very tangible way how this right is being limited, especially in the interest of young people. Because when we think of this right, we think that it speaks to providing treatment. We think of it providing treatment to older persons, when necessarily there needs to be a bigger conversation about the impacts and effects on younger people. Government often responds to visible data. And with non-communicable diseases, they want to see where the fallout is. What have we been seeing as NCD organizations or civil society organizations focused on the prevention of non-communicable diseases? Where's the data that propels our messages? And necessarily, I think one of the greatest points that we can raise is the fact that in my generation, I think for the first time, we can see more than ever the very right fruits of the inactivity of past governments in their approach to the health of young people and people in general. So before, the protection of health and non-communicable diseases was disproportionately skewed to treatment. And I think today, in some instances, it still is. And what we see from that approach is that today, young persons at younger ages are developing non-communicable diseases. So we have 14-year-olds, 16-year-olds who are developing hypertension, diabetes, and other diseases. So no longer are we seeing these illnesses in persons who are older. No longer are we thinking about it as end-of-life disease. You're 65 or somewhere above there, you start developing a non-communicable disease. At a younger age, we're finding that younger people are developing these diseases, and that necessarily speaks to the need for governments to implement these preventative policies. I mean, just in my environment in Barbados and across the Caribbean, we have staggering statistics of 1 in 3 Caribbean children being obese or overweight. And what that necessarily leads to is a life earlier on in their life and the risk of developing a non-communicable disease. So when we speak about preventative policies, when we speak about the prevention of non-communicable diseases, we're speaking about the protection of young people and their rights. And that is not a discussion that should be having silos. That's not a discussion that is unique to civil society organizations, but that is a discussion that the government should be leading. I mean, a bit later on, we'll talk about the role of the youth, but necessarily we should understand now that this is a human rights crisis. This is our right to health. And unless we have preventative policies, and not only treatment, unless we have preventative policies, then the government is failing us time and time again in the protection of our rights as young people. This is why we're involved in the conversation. This is why I'm involved in the conversation. And it's always interesting to see the different approaches that can be brought from young people, whether it's a socioeconomic aspect, whether it's that legal intervention, but necessarily the voices of young people are critical to this discussion so that we can identify and exemplify that today, more than ever, we can see that young people are disproportionately affected by the inactivity and inertia of governments in the past.
Thank you for that, Pierre. I couldn't agree more. And I think, what we're seeing in terms of differentials of mortality rates in COVID-19 are due exactly to this issue of early onset of non-communicable diseases and their risk factors, untreated hypertension, high prevalence of type 2 diabetes, but also, as you say, our failure to prevent these conditions from occurring in the first place. So thank you for your work on all of this. We're also really fortunate to be joined by Monika Kosinska, who's the head of economic and commercial determinants of health at the World Health Organization. Congratulations on your appointment as head of this new unit at the WHO. Can you tell us about this new work stream? Why do social determinants of health and within that commercial determinants of health matter for non-communicable disease control?
Thank you very much, Amanda, and thank you very much to the organizers for inviting me to be part of this incredibly interesting and important panel. So this is in fact my first public engagement as head of the new work stream on commercial economic and commercial determinants. So it's a great pleasure for me to be able to dive in and share the plans and our thinking about this as it really develops live. We're right at the beginning of our thinking on it. The first thing I wanted to perhaps give a little bit of a background to is that the appointment or the creation of this work stream is really within the wider context of a greater attention to the social determinants within the work of WHO as a whole. The general program of work, the 13th general program of work, calls for this as a priority for us as an organization. A new department on social determinants was created, and a strategic meeting was held at the end of 2019, which particularly identified commercial determinants as one of the areas within social determinants that WHO should be working more on, together with urban health actually as a second priority within that. And so that led to my position and the creation of this new strand of work. And it's very much reflective of what we're seeing within the wider context. This decision was taken before COVID, but as was heard by previous panelists already, today we have really seen how the impact of the pandemic has spread throughout our pre-existing vulnerabilities, including the non-communicable disease burden. And as we all know, of course, our health outcomes, our risks are shaped very much by the environments in which we live, love, work, and play, as the Ottawa Charter told us. And the role of the private sector within shaping that environment is something that we've known for a very long time. And WHO certainly has had significant work on this in various areas, a little bit of commercial determinants specifically before, but a lot of work on we heard it on tobacco, on individual determinants and individual risk factors for over 20 years in this way. And so we have a lot to build on. And the private sector here, it's important that we see it as a sector. So it can be a force for good, and we've seen that many times within the COVID response itself in terms of the rapid mobilization, particularly at community level for the private sector. But the influence that it has over our physical environments, over our social and cultural environments, and indeed in terms of even our work environments, if we think of the private sector as an employer, but also, of course, our regulatory environments over policy, over political processes and regulatory systems, not only at national level, but also internationally, and we know that. So this power distribution, including the asymmetries of power that we see within commercial determinants and asymmetries of information, is a fundamental point for us to think about when we're thinking about this work. But we do have effective strategies for engaging with the public sector, and a lot of work has been done in many different areas, some of which have been mentioned today. And the fiscal dimension and fiscal tools and instruments are critically important within that. And we're starting to conceptualize this work as we're moving forward. And we're thinking about this in terms of two domains. So of course, the core business of the private sector, so the goods, the development and design of those goods, their sale, the private sector as a workforce, the private sector as a procurer, as an owner of vast, complex supply chains and logistical chains, but then also the private sector as a corporate citizen, as an influencer of public spaces, of individuals, but also of political processes. And then within that, the manifestations of what that looks like in terms of policy and what that looks like in terms of our economic environments, and then the bigger links to economic determinants, development, investment, and trade. So this is very much the beginning of the conversation, and I welcome being able to be here and talking to you about it today. We will continue to have dialogues, and including with civil society and youth. And I hear the voice and the call from my previous speaker is to that effect as well. So just my final points before I hand back to you, Amanda. You asked what we do, and our priorities for now are very, very simple. So the first of all, it is about raising awareness of commercial determinants, that these systemic and systematic drivers and engagement and role of the private sector are an important part of what determines our health and also our health equity. What are they and why do they matter for us? The second is that we know a lot. There's been a lot of work already done under the Framework Convention on Tobacco Control, but not only. And the experience from South Africa, for example, is one excellent example of what there is. But there is still more to do, and we still need to understand some of these levers and some of these potential mechanisms for how we can best gather the co-benefits whilst protecting our systems from conflicts of interest. And then finally, what we want to do, of course, ultimately is support countries in their engagements with the private sector in a way that leverage these co-benefits, but prevent the conflict of interests as they take the decisions that are important for the health and health equity of their populations. So thank you very much, and I'll stop there.
Thank you, Monica. So that is a very it's a simple list, but it's quite a hard list, ambitious list. So we'll look forward to hearing more from your unit and working with you. Now we're going to do a lightning round back to the panelists because I want to give time to some of the really good questions that have come up. So starting with Dr. Lin. Okay, considering the current situation in many countries with diet-related NCDs and poverty among the underlying conditions that make people more vulnerable to severe COVID. We've just talked about that. Health systems buckling under the strain of acute pandemic needs. What is the best use for tax levies in this context? Are you seeing more space to act?
Yes, what we have identified as a need, can you hear me, is more public education for people to understand the link between the intake and the risk factors, and not only just being obese, with the understanding that you may not necessarily look obese, but you are at risk of NCDs. So that amount of education, I think it has not reached our communities enough. You pick this up even from the responses in some of the studies that even if they can increase the price, we will get used to it and we'll still continue buy beverages as we were used to before. So that for me indicates a lack of understanding. So it's very important that we invest in public education, and people need to understand what are the challenges in terms of some of the alternatives that they may actually choose when they reduce the intake of other sweetened beverages. So a lot of investment in public education is needed. But secondly, research, we need to continuously monitor the trends and the market changes, because industry at times they are usually far ahead of us. So we need to invest enough in research. We need to understand the impact of products that are used when reformulating some of these SSBs. For instance, we now see an increase in sweeteners, the use of sweeteners in products. We're seeing the diversion of sugar being diverted from the SSBs to other products. You can now buy bread that is sweet, which is something that we have not necessarily had, because you would find sweetness in cakes, not in just bread. So all these changes, there's a need to monitor them, there's a need to invest, there's a need to communicate back to the community in terms of all these risks and the challenges. And I think communities also need to be educated to appreciate the policy decisions that are taken, that it's actually for their own benefit. It's not just government wanting more money in their pockets. I think I could end there in response to this question. Thank you.
Thank you. I think you're also talking about education, trying to move these norms that communities may have about how consumption patterns, what is good to consume. And we have a question that we'll come back to later on sort of the role of your social network and the norms in your network in terms of what your consumption patterns are. So we'll come back to that. Allison, back to you. You gave us a tidbit ahead of time, but we know that the implementation of the minimum unit price was delayed, but is it showing signs of effectiveness, particularly among the heaviest drinkers? And tell us a little bit about this issue of people living in poverty and how to think about those, what economists, many times people talk about regressivity that it affects the poor more to implement some of these taxes, but also the benefits also go more to the poor as well sometimes. But can you tell us a little bit about that?
Yeah, thanks, Amanda. So firstly, the expectation of minimum price in Scotland was that it would reduce alcohol consumption by 3.5%. And that reduction would be more significant amongst harmful and hazardous drinkers. But more importantly, in terms of the harms, the effect would build over time. That's because of the time lag for some of the conditions that alcohol causes. So over 10 years, we'd expect it to build to full effect in terms of reducing harm. And again, we would expect the effect to be seen more in harmful drinkers, and particularly amongst poorer harmful drinkers, because they are the people who experience the greatest harm. And you know, that's by orders of magnitude here in Scotland. So at its height, you were 13 times more likely to die in alcohol-related death in Scotland if you were from the poorest communities than from the wealthiest communities. So you could see there's a really strong gradient there in terms of the socioeconomic impact of alcohol. And we know that's because of the alcohol harm paradox, that more alcohol, people who drink more heavily amongst poorer groups are drinking very much more heavily, but also they're experiencing greater harm drink for drink. So that inequality is kind of baked into alcohol consumption and harm. But the early signs from implementing minimum unit pricing are very promising. So what we have seen is that 3.5% reduction in alcohol consumption, that's what we've seen in the off sales. That was what was predicted, and using the comparator of England and Wales, that's what we've seen. We've only got 1 year of data so far on alcohol specific deaths. So obviously you can't read too much into 1 year of data, but we saw a reduction in deaths of 10%. And that brought deaths in Scotland to the lowest level in 16 years. So that's really encouraging. We've also got 2 years of data on hospital admissions. We haven't seen a change in the overall level, but what we have seen is in relation to alcohol-related liver disease, we have seen reductions in each of those 2 years of data. And if we look at that longer term effect of alcohol deaths and the differential, between those in poverty and those who are better off, we've seen that differential drop from 13 times more likely to die in alcohol-related death to between 4 and 5 times more likely to die in alcohol-related death. So for me, alcohol interventions, particularly minimum unit price, are not sufficient to tackle health inequalities, but they are one of the few targeted interventions that we can use, whilst obviously we also need to address the underlying structural inequalities that drive poverty.
That's extremely interesting. Thank you, Alison, and for your work on this. Nandita, do you have any particularly egregious examples of subsidies on fossil fuels or alcohol that you've told us about the big picture? Can you give us a couple specific examples of the health impact of this?
Sure. So as other panelists have described it, as you have also said, Amanda, I have to say all of the examples in our report are in fact egregious, but I will point to a couple. One, for instance, that we report is the use of development assistance to promote alcohol industry. We find examples of this particularly sent towards countries that already experience high burdens of alcohol consumption. For example, we have one in our report of Western European countries promoting alcohol industry via overseas development assistance in Central and Eastern Europe. And this is assistance that really ought to go towards the welfare of recipient countries, but in fact, it's going towards industries that ultimately harm the host. And so that's one that we would offer up. Another is in the form of—
Can you be more specific? Like exactly what did you see? What are they investing in? Are they investing in breweries or what does it look like?
Indeed, in breweries, it is investment in breweries. That is what's the investment, yes. The other one that I'll expand on a little more is marketing deductions. You know, marketing is a tool by which unhealthy commodities are normalized. They're made to seem not just benign, but also beneficial and attractive. And therefore, a number of frameworks call for restrictions on marketing. What we find is exemptions on marketing budgets. And so, for instance, here we have an example of in the US, about 1.5 billion for beer advertising being exempted. So these are specific examples of a fiscal policy in direct contradiction of the stated intention of alcohol policies under NCD prevention strategies in countries that are worth addressing.
Thank you. Yeah. Okay, Pierre, back to you. You've already noted that much of the exposure to risk factors starts in youth, driven by commercial strategies. So if you had one ask of private sector production, marketing, selling of products that contribute to NCD, what would it be?
Thank you very much again for this question. Now, the difficulty with this is that I can say what I want them to do, but they're not necessarily going to do it. But I would prefer if instead of blocking and fighting against, they support preventative policies against non-communicable diseases. I think we all can appreciate that within our countries and regions, the private sector for many, many years have acted as roadblocks to the implementation of preventative NCD policies and ensuring the right to health. You know, some places are a little sublime, but in other instances, it's outright lobbying against the introduction of preventative policies. And these are necessary measures we need to put in place in terms of protecting the rights of our people. And they do engage in highly unethical practices that, you know, should not be seen as irrelevant or moot points when we're considering how we look about lobbying or advocating for the prevention of NCDs. One specific example I show you is that in the Caribbean, we're currently working and lobbying for governments to introduce front of package warning labels. And what that necessarily says is that corporations looking to export items to Barbados or to the region necessarily would have to ensure that on the front of their packages, there's a high in warning label, so high in sodium, high in fat. But necessarily, whilst we've been lobbying for this is for the protection of the health of our people, we have seen significant backlash from the private sector who've started their own webinars, they've started skewing their own information, they've started doing their own things in terms of saying front of package warning label is not necessary, the health situation is not that dire, the government can do other things in terms of protecting the health of their people. So I need, or I would like rather, for private sector organizations to support these policies. And when we look at the COVID-19 pandemic just last year, we saw that many of them came to the fore signaling virtue, and you can check out the NCD Alliance's recent publication on the tactics and strategies that they used during the COVID-19 pandemic. But we saw various corporations putting themselves forward as humanitarian organizations to support the protection of people, you know, putting finances into the protection and prevention of persons contracting COVID-19. But we do understand that their main interest is the bottom line dollar. And that speaks again to the role of government to ensure that they commit themselves to protecting the rights and health of young people. But to the private sector specifically, we need them to work with us. And that's very difficult considering there's always a conflict of interest. But we need them to stop blocking those policies that protect the health of young people and necessarily support in some tangible way the steps we're making to ensuring that lives are protected.
Absolutely. I mean, corporate social responsibility would sort of demand that, you know, these kinds of prevention, evidence-based prevention measures would be at least acknowledged and taken on by these groups. So thank you for your work watching. I think watching and holding groups accountable in the public domain is really a big part of this. So thanks for all that you do. Get back to you, Monica. The World Health Assembly is expected to discuss and adopt a new resolution on social determinants of health. What's next for the WHO on that, on the implementation of such a resolution?
Thank you so very much, Amanda. And we are all very much hoping that this goes through and the member states will decide in their wisdom to go ahead with it. This is very exciting. I know I'm pushed for time, so I'm not going to talk about it too long. It is a soft, relatively soft mechanism, but it's a very important political recognition of the challenges that we're facing and acknowledging, agreeing that addressing health equities and they are unjust and unfair, and engaging all aspects of society, all aspects of government in that solution, particularly when we're moving into COVID response, is a very important political statement. So we do hope very much that this does go through. And I'm going to use my privilege of speaking last to such an inspiring panel to say, concretely on the commercial determinants, I wanted to pick up from what Pierre was saying here. And what I thought was very interesting is he mentioned at some point that these are unethical practices. And I think this is key, perhaps, in terms of how we see the implementation of this going forward. We tend to focus on hard instruments. We focus on political instruments, on legal instruments, on fiscal instruments, and these are critically important, of course. But we also know that the implementation of them is very difficult, and it's harder in some contexts than others. But what I think is important, and it's one of the reasons that we also want to look at commercial determinants, and I'll slow down because I'm speaking very loudly, very quickly for the interpreters, forgive me, I'm too excited about the topic. But what we want to look at this as corporate citizenship, because ultimately we are also talking about corporate norms and ethical behaviors. These are accepted behaviors within society. You said corporate social responsibility, Amanda, but it does go beyond that. These are ultimately behind the industry actors, economic actors are people. They are part of society. They sit and live within communities. And in our smaller countries and on a local level, it is really, you cannot differentiate between what is private sector, what is not private sector. And so this is a very interesting point, thinking about how we see our engagement with the private sector, not only in terms of an amorphous, faceless sector, but also in terms of what are expected norms and behaviors within a society, because we cannot achieve what we hope to achieve unless we all work together.
Agreed. And as you said, sometimes, this distinction between, civil society, private sector, we're all just people that live in the same place, and we should try and do the right thing. So we're going to take a couple questions from the audience. We have this Q&A box on Zoom, or a reminder that on Twitter, there's the hashtag Vital Talks or Act on NCDs. But let's, I think all the panelists can see them. We've already kind of covered, one question was about if these taxes are at point of sale, to what degree they disproportionately affect lower income individuals. How do you compensate for that? We've already talked, especially Allison's comments about the disproportionate benefits that also accrue to the people who are living in very poor communities, or who are the most, who are consuming more. But maybe I would ask Lynn or Allison to reflect on this issue of how, what's the evidence on this in terms of who's affected by such fiscal measures, and what are the appropriate policy responses to that? So maybe start with Lynn and then Allison.
I'm sorry, I missed the question. I had a slight challenge. Can you please repeat it?
Yeah, so it's how do these taxes affect people living in poverty? And we've talked about how the benefit of the taxes, the health benefit of the lower consumption, has accrued more in these poor communities, but they also face the higher prices as well. What would be your response? Maybe we'll start with Allison to give you time, Lynn, to think about your response. Go ahead.
Thanks, Amanda. Yeah, I think we can often in the public health community not be particularly good at explaining the benefits to people in poverty. It is complex because there will be a multiple range of factors as to why people suffer greater harm. It may be because of comorbidities. It may be, you know, they're more likely to be smoking or more likely to have to be obese, or it may be to do with housing as well. So there's a whole range of reasons why people on low incomes may be more susceptible to suffering disproportionately when they are drinking perhaps the same level as people who are better off. But we also see, certainly here in Scotland, a polarisation. We see more people in low income groups who are completely abstaining from alcohol, but people who are drinking heavily, drinking very much more heavily than other income groups. But I do think, you know, during the minimum unit price case, the lawyers who were acting for the alcohol producers talked about, well, if you're trying to reduce health inequalities, then you should solve poverty. And that, of course, is a false way of characterizing the problem. Of course, we need to be acting on poverty. We need to be addressing the structural inequalities, but we also can use these targeted measures, which can also contribute to reducing that terrible gap in how unequally the effects of alcohol consumption are felt on our communities. And I would also say, you know, this links across to other population measures, such as the availability of alcohol. We definitely see a targeting of poorer communities here in Scotland. There are far more places to buy alcohol in our poorest communities than in our richest communities. That's no accident. The industry is targeting those communities.
Thank you. So Lynn, just to add, there was a question that came in also about, you know, for example, in an informal settlement where there might not be access to clean water, if sugar sweetened beverages become more expensive, what are the other options if government and community doesn't address the water issues? It's a kind of related topic.
Yes, I mean, this is one of the arguments which was used by industry when we were advocating for the sugar tax, that it will hit very hard on the poor communities, and where there is no water, then beverages may be the option. But the same amount of water or even more is actually used to make the beverages. If industry wants to assist poor communities, then one of the issues is to make water accessible to those communities, to work with government to make sure that poorer communities have access to water, because most of the water is used to prepare these beverages. But with education, as much as there may not be, I mean, people do have water. It's just that the water may not be safe, and we just need to educate them on how to make the water that they get from the river and whatever to be much more safer. And the importance of drinking water, because I think this is one area which we are a bit weak on as various governments in terms of not teaching people enough or educate or engaging them in making much healthier choices when they do make choices. This is the argument that is raised, that you are actually disadvantaging poorer communities even more by making sugar taxes. But these are the same communities that have more serious NCDs and who are spending more money on health rather than the richer communities. So it's about that engagement and making people understand so that they can eventually make healthier choices. Thank you.
Yeah. Thank you, Lynn. I'm going to do a last question to Nandita and Pierre, and this is important. One of the participants asks, I haven't heard much about tobacco. What's going on? And I think, you know, one thing to say is that alcohol is still much less taxed than tobacco, and yet it also contributes enormously to NCD burden. But the agenda on tobacco is so far from finished. So, and Nandita and Pierre, can you reflect on that?
Thank you. I did notice a couple of other questions that perhaps I'll just try to weave into my answer, if you'll permit me, Amanda. I think it's a good question. I think we cannot any longer look at unhealthy commodities separately: tobacco, alcohol, sugary drinks, ultra processed products. We've got to have a consistent, systematic way of looking at them. I think a second principle that applies across all unhealthy products is looking at it from an ecological perspective. We've got to look at it from the macro level perspective in terms of how price, availability, a number of those factors affect uptake, as well as social networks. I loved that question on social networks. I don't think there's enough time to completely unpack it here, but social networks are incredibly important for normalizing that use, promoting that use, and they're a powerful influence. So how do we use a series of policies from the macro level, economic policies, behavioral nudges, to direct communication with communities, helping make alternatives available is crucial. Tobacco provides a really good framework of examination from the Framework Convention on Tobacco Control, the comprehensive legislations that exist. It also provides us an indication of how industries and these products evolve, and therefore the need for continued vigilance and evolution of policies to address them as well. I'll just stop with that here. Thank you.
Thanks. And Pierre, and also a question about, are there some examples of companies that have embraced the agenda as part of social responsibility? So a company that you would call out as a good citizen?
Okay, thank you very much for the question as well. And I just want to go back to the point Andita made of, when we are thinking about the policies that we put in place, they necessarily need to be updated and relook over time. I think in Barbados, for example, we have had quite the success in terms of our approach to tobacco. And necessarily, we do have those warning signs up on the packaging. There are no more attractive packages, and on the front of it, there's a big warning sign that says, Ministry of Health does not recommend that you use this. So, and the efforts and the advocacy and the movement around tobacco was successful. But what we are seeing now is that there are new introductions of nicotine type substances. So we have e-cigarettes, we have persons who are vaping, and that necessarily means that the government has to update their policies and their approach to this type of harmful lifestyle practices. And that speaks to a wider thing where, as society, as advocates, civil society organizations, our job is not only to ensure there's development and implementation of policies, but we need to hold the governments accountable to updating these policies over time. And specifically to the point of corporations that may have helped or have been amenable to these type of interventions. We do have one company, I think it's the Sagicor Group, who have been really, really helpful with the Healthy Caribbean Coalition in ensuring that when we put our messages out there within their organization, they ensure that their persons, their workers support it, and they support and finance, in some instances, the projects that we have in place. And it's part of their corporate social responsibilities. If more companies, more private sector organizations did this, I'm sure we'd be in a better place today.
Absolutely. Okay, we're at the end of our panel. All of you have made incredible contributions. They've asked us to say it in a tweet. What is your take-home message for the audience? Maybe we'll start with Pierre, since you have been last in the round. What's your tweet? What's your call?
Thank you. So I'm going to put on my law hat just for a minute and say, you can't legislate health, but you can legislate the protection of health. We need policies. We need concrete policies from our government to protect the health of people and protect their rights.
Excellent. Andita.
Okay, phase out incentives for unhealthy commodities while investing in social programs, and make fiscal policies and finances work to prevent NCDs.
Excellent. Allison.
Public health prevention works and has never been more badly needed. Every country needs to look at the who best buys, increasing price, controlling availability, and reducing marketing to improve and save lives.
Good one. Okay, Lynn.
Fiscal measures do contribute to reduce consumption. Countries should take the bold step, and countries need to invest in research that will support the policy decisions that they make. It's also important to educate the communities so that they can buy into the policy decision that government has taken. Thank you.
Thank you. Well, I think you're all experienced tweeters. It's evident this has been a great discussion. I've been privileged to moderate it for you. Thanks to the speakers, to Vital Strategies and the NCD Alliance. I'd now like to turn to Nina Renshaw, who's the Policy and Advocacy Director of the NCD Alliance, to provide closing remarks. Thanks a lot.
Thank you so much, Amanda, for your skillful moderation. It's been a pleasure working with you on this. Hello, everybody. My name's Nina Renshaw, and I'm Policy and Advocacy Director at the NCD Alliance. So as we come to the close of our program today, on behalf of both Vital Strategies and the NCD Alliance, I want to thank very sincerely all of our speakers for their time today, their insights and their dedication to the topic. Just today, WHO has updated their global health statistics, which show that even before the pandemic, the global share of NCDs deaths among all deaths increased from 61% in 2000 to 74% in 2019. Diabetes and dementia are now among the top 10 causes of death worldwide, alongside heart disease, stroke, cancers, and lung disease. As we heard from Pierre, our generation and previous generations have failed to act on the evidence. We haven't done enough. To respect the rights of young people, governments have to ensure the environment that they live in gives them the best opportunities for happy and healthy lives. Clearly, we're not there yet. And let's hear it for young people like Pierre, who's speaking out to advocate loudly for government action that protects their rights to health today and throughout their lives. As we've heard, particularly from the Scottish experience, taxes and pricing policies on unhealthy commodities can be designed to ensure that they're fair and progressive and that they reduce exposure to risk and health inequalities. And we heard as well from South Africa that these instruments can raise significant revenue, which can be reinvested into promoting and protecting health and bring further equity gains. A really key takeaway from today is where these measures have been implemented, they've been proven to deliver important results for population health and offer the biggest benefits to the poorest communities. As a result, these are being taken up as effective policy options to improve health and equity all over the world. Over 40 countries now apply taxes on liquid sugar, as Lynn put it. An OECD report was published just earlier this week, which calls on governments to implement robust pricing policies for alcohol and emphasizes that the return on investment is $16 for every dollar spent on alcohol policies. And to hear more about that, you can join us next week for a WHI side event, specifically taking a deep dive into alcohol policies with Mavendi International and with speakers from OECD, PAHO, the Americas region of WHO, and the European office of WHO. We also heard from Nandita, the other side of the fiscal coin. Subsidies and incentives which benefit health harming industries increase health inequalities. And we know that the health impacts, whether that's alcohol harm across society, air pollution, food deserts, food swamps, most affect those who can least afford it. And we heard from Amanda at the start of the session, in today's incredibly strained fiscal context, economic instruments that can benefit our health can also be a further win-win in terms of generating revenues, and these can be used for much needed strengthening of health systems. So to come back to why we wanted to talk about this with our audience today, and thank you so much for your questions and your active participation in the chat and in the Q&A box. The pandemic has really accentuated the need to act on NCD prevention, and there are bundles of these smart evidence-based policies available for governments to implement. All over the world, people living with NCDs have been in the crosshairs of the pandemic. We know that hypertension, cardiovascular disease, and diabetes have been the top 3 underlying conditions among millions of people who have died from COVID-19. And it's been a really bitter irony that the industries who oppose the measures we've been talking about today have spent the pandemic calling for weaker regulatory responses. They've been calling for tax breaks. And at the same time, they've been adapting, shape-shifting, stepping up aggressive marketing during the lockdowns, and particularly targeting our young people and our poorest communities. As Monica and Lynn both alluded to, this imbalance of power is something that governments must monitor incredibly closely and at long last effectively address. In the same way that we've turned the tables on tobacco, alcohol, junk food, and polluting industries must no longer have a seat at the table for health decision-making. Just as one final remark, as governments seek to build back better and fairer from the pandemic, we've gained new understanding of the value of prevention of NCDs. A healthy population is the bedrock of resilience. Action on NCDs must, going forward, be understood as a vital part of our health security and preparedness for other health threats. So on that closing note, I'd like to extend a warm thank you, not only to our speakers again, but also to our audience for your participation today and for the dynamic Q&A. To watch the recording of this event, again, you can visit vitalstrategies.org or ncdalliance.org. We thank you very much, everyone, for joining us. Please enjoy the rest of your day and have an excellent weekend. Goodbye.